Next, I'd like to introduce our second fireside chat. We'll hear from Dr. Naveen Rao of the Rockefeller Foundation in conversation with Dr. Chad Malone of Abbott. Dr. Naveen Rao is Senior Vice President of Health at the Rockefeller Foundation, where he leads the foundation's work to ensure more equitable access to COVID-19 tests and vaccines, science-based tools, and data to fight the pandemic, while strengthening public health systems to prevent future outbreaks. Under Naveen's leadership, the foundation launched the Precision Public Health Initiative, which rapidly expanded to address the COVID-19 pandemic. Dr. Chad Malone is Director of Global Medical Informatics and Clinical Care Excellence for Abbott's Diagnostics business and a physician with a passion for technology. His work is focused on improving patient access to testing and care, as well as the clinician experience through innovative software and system solutions. Chad has more than 25 years of global experience in biomedical informatics, medical devices, and clinical and translational science, incorporating a strong information technology background and experience in healthcare data strategy, clinical practice, and patient outcomes. Chad, over to you. We're looking forward to your conversation with Naveen.
Great, thanks, Nikhil. You know, it's great to be here, and those who aren't familiar with Abbott, we're in the business of creating life-changing technologies to help people both improve their health and live happier lives. Those include diagnostics, medical devices, nutrition products, branded generic medicines. One example of our consumer technologies are Freestyle Libre, which is a continuous glucose monitor that reads real-time glucose data from a patch on the upper arm of a patient. And this is just one way of how data is transforming our business and allowing this data to have insights that impact how a clinician practices, and more importantly, how a patient gets care and ultimately that healthcare outcome in their journey. Now, in diagnostics, I play a little different role with data. We are taking both clinical data and patient-generated data and bringing it together and offering insights at the point of care to help make faster and better decisions for these patients. This is why I'm so excited to be here with Dr. Rao. And as we both know, and all of us know, that big data does hold tremendous promise in delivering equitable outcomes. However, the gathering, the analysis, and the application of this data needs to be inclusive. And we talk about population health, and we talk about public health, which has kind of become kind of a white word, white noise in healthcare. You can't treat a population unless you treat the individual. And really where I'm focused is taking that excellent clinical data, which is great, but bringing it together with the patient voice, the patient-generated data, the patient-reported outcomes, and social determinants of health to really drive better healthcare. Just one example of that is recently with the COVID issues we've all had. We had a health system mass surveil with our technology through a very friendly mobile survey tool, their entire population to understand COVID risk and where their at-risk populations were. But they also included questions around food scarcity, transportation, mental health, depression and anxiety screening. But they also asked, would you like a phone call? And of course, the health system was able to help people get access to food, transportation, and help with some of those mental things they may be facing. But more importantly, 19% of them wanted a phone call. They wanted reassurance, a touch from someone they trust in a very stressful time. And as we look at this intersection of data and healthcare, there's challenges and obstacles to overcome, but there's a tremendous potential for shared value. And bringing the patient voice into the clinical practice and to the clinician to be able to make better choices that are patient-specific is really the core of our Abbott 2030 sustainability plan around data. We really need to meet people where they are emotionally, physically, and of course, clinically. And this is the best way to drive equitable care and drive shared value. And that's why I'm delighted to have Dr. Rao with us today from the Rockefeller Foundation, joining us in this discussion. Thanks, Dr. Rao, and I'm excited to chat with you today. First thing I want to ask, which is a little different than what we were going to talk about, is when we chatted earlier, you really wanted to make a point initially around the difference between healthcare and health. Start a baseline here. What are your thoughts there?
Thank you, Chad. Thank you for the opportunity. I apologize for the background. I know this is a fireside chat, and actually I'm in a hotel in Geneva that has a fireplace in the lobby. I was very tempted to take it down there and have a fire going behind me to make this a fireside, but unfortunately I'm in the hotel room and you're probably seeing the pillows on the bed. So apologies for the background. I do thank you for the opportunity, Chad, and I also appreciate Shared Value Initiative to invite me. This is really true, what you say, and a lot of us confabulate health and healthcare. The moment we say health, many of us automatically think of hospitals, doctors, medicines, and all that is healthcare. We go there because that's the shiny toy, that's where the investments are, that's where we talk about, and in fact, US has the best hospitals, medicines, and doctors, yet during this COVID pandemic suffered because the other end of the spectrum is health. And health is not healthcare. In fact, healthcare is for the people who are already ill. What we do on the healthcare system, and I'm part of it as a physician, is we tune you up and put you back in the environment that caused the problem. So if there's a young girl coming to the hospital emergency room with asthma, we treat her asthma and then send her back to live on top of the bus depot where she's inhaling all the gas fumes and is going to come right back. On the other side of the spectrum is health. And health is who you are, where you live, your level of education, the food you eat, the air you breathe, the amount of violence you're exposed to. That is health. By the way, health is 80% of health is social determinants of health. Only 20% of your health is healthcare. We confabulate the two, and the importance of having data on the health side that looks at the social determinants of health to put it in context is absolutely vital, because our health care is getting better. We are getting better and better at fishing bodies out of the river. We can fish more bodies out of the river today than we did 100 years ago because of healthcare technology advances. But the question we need to ask is who's throwing them in? And what can we do at this end of the spectrum? So that is the health and healthcare point I was trying to make, and how important data is in that sense.
No, that's great. And as we look at that, right, there is, of course, gathering that data. And sometimes gathering that data can be an issue. And, how do you see, or what path do you see in getting the data from those areas or from segments that would not submit that health data, right? Not the healthcare data that, in the hospital, that's one thing. This other data set that is so vital. What are your thoughts around accessing that or helping access that?
It's a great question, and I appreciate that, Chad, because traditionally, when we look at health data, we're automatically going to medical health records, hospitalizations, and all that is vital and important. And in fact, we got a head start on COVID because of all that. So I'm not belittling all that data, but equally important are signals in the non-traditional data sets that give us direct evidence of what's happening. A few examples. There are communities where we hear that cold and flu medications are flying off the shelf. Should ask us a question: what is happening? Why all of a sudden there's an uptick in those medications flying off the shelf? There is data about school attendance, or in certain communities we suddenly hear children are not coming to school. There's some diarrheal disease going around, and so why are there suddenly a drop off in child attendance? The story is that there was a Canadian organization called Blue Dot that signaled to the world in the early days of COVID, before even anyone had heard of it, that there's something happening in Wuhan, because they saw a lot of travel out of Wuhan and they were able to connect saying something's happening in Wuhan, people are leaving in droves. That data didn't come out till later. So there is the traditional data, and then there's the non-traditional data. We need to be able to look at migration patterns, health, weather. We need to look at food and put all that together. And it's not just healthcare data. And in fact, when we're able to do weather forecasting on waterborne illnesses like cholera, we're able to say we know where we need to put the resources because where is it going to rain is where we need to put our resources. So it is really important. And in this context, I really feel there's now a divide between the haves and the have-nots. Maybe the class division of our lifetime used to be money, and those who had money had better health than those who did not have money. I predict that the new class divide of the future will be access to data, and those who have access to data will have better health than those who do not. One last example. If you look at in our own lives, how having access to data has changed our life. I mean, before there was Carfax, you had to depend on the car salesman to tell you which model and how much to pay for that model of car. Today, Carfax puts the power of data in your hands. The story is the same with Zillow and real estate. All of a sudden, you know the exact value of your house. The story is the same with Expedia and travel costs. And so the power of data in your own hands has come in so many different ways in so many parts of our life. It's time it comes to health. It will come to health. And again, when it comes to health, there shouldn't be this divide between those who have access to data and those who don't. So that is where I posit it.
That's great. So I want to follow up in a minute on what you were talking about, the signals and the pandemic. But if we back up to what you were just saying, the question is, how can industry help access or give access or grease the wheels for those folks that don't have access to submit that data? And we mentioned kind of the democratization of data through, the Zillow and the Kayaks and Carfax and things of that nature. But within healthcare, we do have various populations that don't have access to certain things, or we just can't get the data because of that connectivity. And when we previously chat, you mentioned some interesting things and some thoughts you had around how industry can help bridge that divide. Love your thoughts.
Thank you again. Chad, it's absolutely true. So the question is, what drives the private sector? Probably the same things that drive the public sector, the academic sector. It's basically incentivizing for the right results, leveling the playing field, making it easy, and looking for local solutions. So if you really look at what technology is available, where it is, and the story with Kenya and financing, and how 80-90% of all Kenyans now use M-Pesa. And who would have thought that in a country in Africa, there'd be more use of digital financial transactions? But it was all because of mobile technology. And now mobile technology is everywhere. So for us to say, how do we get access? It's just a question of incentivizing and putting in layers of protection and coming into it with an equity mindset. But we need to incentivize the private sector to be able to show up. There needs to be something in it for them. And if there is, innovation will happen. And it has happened in so many other fields, including financial, which is as sensitive as health when it comes to private data and security and all that. But it has been done. And there's proof that it can be done. So we need to meet local communities where they are with technologies that are available, incentivize the local private sector, and to put in safeguards to make sure it's equitable. Again, I feel it has been done, it can be done. I don't know why in health we're still almost 20 years behind weather forecasting.
Well, it's also very interesting. It's not just incenting typical healthcare companies. What you're talking about is incenting the other enabling industries around things that can impact our industry and the health of that patient. So that is something that definitely needs to be worked on. I think all of us here. I want to get back to what you were mentioning around the signals and the pandemic. And I know you've done some recent work on both the prediction and preventing of future pandemics there at the Rockefeller Foundation. Here at Abbott, we do have and work on a coalition called the Abbott Pandemic Defense Coalition, which is a network of expert researchers for looking for the early detection and rapid response to these global pandemics. And I'd love to understand in your work in the pandemic side and early identification and response to, where you see that applying in other healthcare areas outside of a novel virus or a bacterium that we're having to fight on a pandemic level. How do you see it being applicable in other areas of healthcare?
We feel, so by the way, Rockefeller Foundation just announced last week, we committed 150 million over the next few years to set up a pandemic prevention institute. And the reason I mentioned that is that if we can show during a pandemic that we can set systems in place, for example, what we're hoping this Pandemic Prevention Institute will do is have a federated system where we gather local information in real time, traditional and non-traditional, able to analyze it quickly, come up with insights that we can send back into the community with actionable items. So if there is a system, a loop, so to speak, that is democratized, transparent, data-driven, and not politically held hostage, that if we can set up such a system, it would work in peacetime too. Right now, in COVID and the wartime, we definitely need to set it up. Now is when the interest is, and now where the money is showing up. And if we miss this opportunity, shame on us, because this same system will, for example, help us with antimicrobial resistance that's happening in a community. It can help us with various other systems and also be the throughput by which we can get traditional, non-traditional inputs and create local solutions for global problems, local problems, connect that globally. Because, if anything, this COVID has shown us that we see it as public sector, private sector, academic sector, on and on, but the virus doesn't. So we are all in this together. And if we can use this crisis to set up such a system that is transparent, democratic, real time, and protects equitably, and then is able to differentiate this signal from the noise and give us insights that we can act on, then so be it. And let us all work together to set up such a system that will help us during peacetime down the road too.
Well, what's interesting to me, and this is something you and I have previously discussed. This is just a free-flowing conversation, which I'd love to get your opinion. Is COVID, Ebola, these others get the headlines, right? But when we talk about pandemic, you as a medical doctor and myself and others, I think of obesity, I think of diabetes, I think of these chronic conditions that, for whatever reason, are a slow burn. However, they are at pandemic levels. And, as you look at those and other things that we're facing, that you and I would go, that's a pandemic, but the news headlines really don't care because it doesn't cause these immediate tragic outcomes. Do you see, what you've set up and the ability to have that infrastructure, be able to address these other problems that are actually claiming more lives, that are actually eating more cost in the health system? Do you see that being applicable as well?
Yeah, I'm glad you brought that up, Chad. I missed it in my comments earlier, and I'm glad you really highlighted it because it's absolutely true. And it goes back to the fact that more and more healthcare is coming into the hands of the individual, and in which case real-time data signals. I mean, today, for example, it's going to rain on your head within an hour, in the next hour or not. Wherever you are in the world, there is that kind of accuracy that tells you whether it's going to rain or not. There is no such similar that tells you wear a mask because there's an epidemic coming your way. There's no such thing about how to control your sugar, how to, in real time, what it means to get your hypertension, your antimicrobial resistance. We are exposed to so much, and systems like this based on data, and it's happening in other industries. What is amazing is we're still discussing it, whereas there's so many industries around us that have already gone there, and we know it works. And yet, for some reason, when it comes to health, we're still in this debate about should we not.
That's wonderful to hear, because I was just thinking of an analogy as we're closing out. It's we think of COVID and these others. It's like on a stove, right? You touch the burner, it's hot, and you jerk back, and that's a shock. But sitting in the pot of slowly boiling water, you will get to a boil and you will cook, right? And it's going to be just as hot. But it's really wonderful speaking with you. We're very excited about what the Rockefeller Foundation is doing and your contribution to all of this. And we at Abbott are very, very thankful for being a part of this initiative, and do go forward with the mindset of creating an equitable healthcare delivery organization. So I'm very thankful to you, Dr. Rao, and very thankful to the team. Turn it back over to you, Nikhil.
Thank you. Thank you.